Great.
Right? It's nice to see
Cold.
you. Yeah, a bit chilly. Um, I don't know if I have to push record. No, we're going. Good. Uh, so today's topic is unconventional diets, which is one that I'm really interested in just because I feel like it's a source of, I guess, conflict between vets and owners. Um, I know Julian's not working in a small animal practice at the moment, but historically, when you have been, have you seen or had owners who've been adamant that raw feeding is the way to go?
Yeah. Or because I was more rurally, they'd
Mm.
just be like, oh, dogs just eat meat. And it's just like
Um,
um, but yes, I have seen it before. Rarely, but yes.
yeah. And what about your experience, Bron, over the years in GP? What trends are you seeing in terms of what people are feeding their dogs?
Definitely some people like to feed raw,
Mm.
but it's not, I mean, I haven't found it be that many, and often it comes from the breeder, and that's pretty easy to work around.
Yeah.
When it starts with the owner's research in later life, it's a little bit harder to, um, you know, talk
Yeah.
around. But
Yeah.
yeah, increasingly people are really keen to make not. We've got heaps of clients that want to cook home homemade food for their pets, and it's actually really easy now because there's the recipe powder for the nosh recipes around.
Yeah.
So I'm just printing out heaps of recipes, and they just buy the balancing powder so they can make fresh food themselves, and it is cooked.
Yeah. So I work with a lot of different vets, and the attitude of vets towards recommending like home cooked diets, or raw food, or I guess unconventional diets relative to the commercial dog foods is so varied. Like there's so many vets I work with that are just like, you can't make it balanced, has to go with the commercial dog food. There's no way to get the variety of nutrients and things that you need in a home cooked or home prepared diet. Which I think we like as humans who don't eat a commercial dog food, know you can be healthy without necessarily eating like a very
Yeah.
restrictive diet.
Yeah.
So what I think is sort of happening and what like literature shows is that there's a little bit of mistrust developing between the public and vets who are saying, no, we need to feed these commercial dog foods. Because the owners are kind of like, well, logically, I know that's not the case because I don't eat a commercial
Mm.
food or a prescriptive diet. And if you don't want to engage in this conversation with me, then I'm going to seek out information elsewhere, which is a little bit dangerous because that information is very unreliable. So I'm glad to see you here engaged in this conversation. Um,
I'm super excited about it. I mean, I find it really important
yeah,
because I know you've helped me with a couple of dogs who we thought might have a reactive hepatopathy that could be related to commercial feeding. And then I've listened to a podcast recently. We're interviewing this nutritionist vet from the US. I can't. It's on Vet Vault, but talking about how dogs evolved over thousands of years to basically eat human leftovers,
yeah,
like tens of thousands of years eat humans leftovers,
yeah.
not raw food,
No,
but they're
yeah,
herbivores and they eat human style food.
yeah.
So I'm too lazy to cook for my dogs. But
Mm,
if people want to cook for their dogs, if they're doing it balanced, I'm super happy. And my third concern is,
yeah,
humans, we're trying to eat no ultra processed foods now.
yes,
Like in the last year since we had this talk, that's become hugely interesting to me. And
yeah,
then I'm feeding ultra processed foods to my pets and recommending it to clients' pets. So if they want to put in the time and money to make a balanced homemade, I guess I'm feeling that there's probably benefits. I can't
yeah.
quantify them, but I don't know. I'd love to talk about that.
Yeah, for sure. So I spoke to Matt Muir. I don't know how many of you know him, but he's a founder of Leica. He's a veterinarian he's just got this incredible amount of knowledge. And like there's so many different components that go into gastrointestinal health and then how that then impacts systemic health. And he's like world leading expert in this. He just knows so much about it. So I did have a conversation with him earlier in the week, and he sent me through some resources that I've gone through. that I can send to you guys as well, actually. I might just make a note of that if you're interested.
Yes,
Um,
please.
on essentially dysbiosis and the impact on well-being and different disease processes, how we can manage it, use of prebiotics, probiotics, fecal microbiome, transplantation, and raw feeding as well. And I have to say, did anyone actually look at the Edinger chapter on this? It was interesting. Did you, Julian? No. Are you smiling because you feel naughty?
I thought it was a video and I didn't read it. No.
It was like, so it's like three. So this is a really big emerging like conversation, right? So I thought we should at least have a kind of balanced conversation in endurance, literally like 2 pages talking about the risks of raw feeding and like no benefits at all.
No.
And no kind of discussion around, I think the ultra processed food stuff, which we will go into a little bit more, has come out more recently than Edinger was published. So like then this conversation has evolved since it was published.
Yeah.
But I hope that they put a little bit more weight in it in the next edition because it's a really important topic for human and animal health. And as we're sort of starting to see animals treated more as part of the family. In fact, in the UK, they've just done a study on the value of different elements of people's lives on their well-being, and dogs scored higher than children. So dogs are very important in human well-being. So we're seeing people start to acknowledge that and treat their dogs more as part of the family. And they're going to want to cook for them, makes them feel good. Rather than scoop something that they would never eat in a million years out of a bag and put it in a bowl. So that's definitely an evolving theme in pet ownership, and us as veterinarians are going to have to deal with that. So a couple of key terms that we'll be talking about are ultra processed foods. So Bron mentioned this. So they're called UPFs in a lot of the literature, and I don't know, I'm not very good with acronyms, but ultra processed foods, UPFs. But every time I read a paper and it's UPF, I have to look back. What did that mean again? What did that mean again? So ultra processed foods. So Bron, you mentioned that humans are trying not to eat ultra processed foods. Why is that?
I guess there's a few things that we can put I guess there's theories that emulsifiers, they join fat and water together and make them blend and emulsify. And apparently they can disrupt the mucus in the bowel lining and therefore disrupt the microbiome. And then other specific, I can't remember the other reasons of all the other microprocessed foods, ultra processed foods, and why they're not so good. But yeah, I'm just like reading labels in a totally different way now.
Yeah, it's interesting. So anything that's ultra processed, often cooked at very high temperatures, often has emulsifiers and binders in it, often very high starch because it's not actually real food and that's a filler that gives
it needs to bind it all back together again.
Yes, yeah, exactly. So there's a few different components, and what that then develops into is, as you mentioned, a breakdown of the gut barrier. So it breaks down the mucus protective barrier. So mucus is this really nice coating that covers the cells and protects them from being exposed continuously, and therefore the immune system from being exposed continuously to bacteria that needs to live in the gastrointestinal tract and the food antigens moving through it. So if you break down the mucus barrier, all of a sudden you start to get immune reactions to normal antigens. The compound that is most responsible for that, which is unique to ultra-processed foods, and we're going to look at my notes, advanced glycation end products. And there's a few very specific ones that are very closely associated with very serious illnesses in humans. So diabetes, cancer, neurodegenerative disorders, and cardiovascular disease. We're very early in the process of this research being translatable to dogs, but all of the studies done to date essentially say that those parallels are the same between humans and dogs. We haven't really had a full generation of human eating ultra-processed foods. have we? So like our grandparents didn't have access to really super highly processed foods. So we don't really know what the long-term effects are, but we're now starting to get some of those kind of medium-term effects documented in humans. And those are the ones that are probably going to be most relevant to us with our shorter lifespan creatures that we look after. So if we know that ultra-processed foods are associated with serious illnesses and particularly systemic inflammation and the knock-on effects of that, then I think we have to say, okay, well, if somebody has a preference, has looked into this themselves and they have a preference for feeding whole food diets, how can we enter this conversation in a way that acknowledges their wishes, acknowledges the risks, and makes it safe for the dog? Cat, I should say as well, but there's much more data on dogs, so that's easier to talk about. So does anybody, Bronze mentioned she does recommends home cooked meals with nutritional additives to make sure that it's a balanced diet. So that is a really nice tip, the Nosh sachets, if anybody missed that. Is anybody else recommending? So beg your pardon?
Was it not? What are they called? Not sachets?
Nosh, they call the powder is
yeah.
in a tub and it's called Nourish powder, but it makes the recipes that you can buy already prepared as called Nosh, but they give you like 6 different recipes you can make with that powder, and all you add is fresh cooked ingredients, oil, and that vitamin mineral powder, and it's supposed to be, and it gives you nutritional analysis of the food. So
oh wow,
yeah, it makes it so much easier to allow clients to go and cook for their pet.
Yeah. I usually tell people to use a website called Balance It, but I don't know. No one's come back and said, oh, that worked really well, or I've actually used it. So I just remember learning it in one VIN course, but I think it was one to help you learn how to home cook food, but I don't really know much about it.
I think that one's good if you have a known allergen and you need to design a diet excluding certain foods.
Yeah, or like in a low-fat diet, or any animals that need prescription diets becomes tricky.
Yeah, and I think that's where the commercial food companies are so good in that they've got those balanced diets for renal disease, for it's tricky in that situation where patients have specific needs. It's very tricky to recommend a home cooked diet. That's where nutritionists come in, I think. So what does anybody actually actively recommend raw feeding? No. It's interesting. So I think we deal with the disasters from raw feeding. So there's like 50% more likely to be admitted to hospital with HGE for patients that are fed raw meat or commercially available raw food products. I think we know, and the literature that we're exposed to tells us all the risks. So these dogs are much more likely to excrete salmonella, campylobacter, and particularly scarier, the extended spectrum beta-lactamase producing E. coli's, which are a multi-resistant form of E. coli, which is causing havoc in human health. So we really want to reduce our exposure to these E. coli's. So they're resistant to fluoroquinolones and beta-lactamase antibiotics, which leaves us with very few options, actually. It becomes very difficult to... And then if we know that fecal bacteria causes UTIs and stuff like that in our patients, even if you take out the risk to health, you want to avoid all of those extended resistance bugs being present in feces if you can.
And sorry, just to interrupt, I tell clients that if a dog's eating a wild animal, they're not getting exposed to meat covered in fecal bacteria, whereas in the abattoir, everything is covered in all these sorts of, like it's not clean because it's going to be cooked.
Yeah.
Like minced meat where they actually like mix it all together as well.
Yeah.
So like it's different to taking down a whole animal. You're not getting meat covered in poo.
And not just covered in poo, but then like the delay between the processing and the animal eating it, it's quite significant. So those bacteria have been allowed to replicate.
Inoculate. Oh, yeah.
Yeah, and produce their toxin and stuff like that. So there's we can't sort of mimic what would be happening in the wild because it's so different. There's so many aspects of it that are so different. So definitely, I mean, dogs, I'm sure my dogs would eat the gastrointestinal tract of a wild animal if they were given access to it. So I think they're probably ingesting a fair bit of bacteria.
Yeah.
But also a lot of them are dying. And they're not sleeping, those dogs that were eating wild animals were not sleeping on your pillow. So a couple of days of diarrhea isn't
Yeah.
a big deal. Whereas when they're inside dogs sleeping on your pillow, it is a big deal. So we live differently with them. And there's other factors, like it's not just like, let's mimic what they're designed to do. Let's take into account that we're living very differently with them than we used to as well. So yeah, raw feeding definitely comes with risks for sure. We know that dogs fed raw food are more predisposed to cats, toxoplasmosis, dogs, neosporosis, and exposure to toxo and Campylobacter both contribute to development of idiopathic polyradicular neuritis. So there's links to autoimmune disease because of that pathogen exposure, which with like ultra processed food or cooked food, we do
real hum going.
Antigenicity.
Sorry.
Hi. So there are like definitely risks to raw feeding, but the flip side of that, that's actually not reported in a lot of the literature that we're exposed to, is that 90% of clients who switch their dogs from ultra processed food to raw food report an improvement in well-being in various factors. And if we've got 90% of people reporting an improvement in well-being, and there's going to be a placebo effect, like people feel good about having like done something natural or something like, you know, we're getting back to basics with their dog, but there must be significant health benefits to an element of that food, even with those risks. So you can see why clients start then telling all their friends to feed raw and why there's this bit of a movement towards it. So then if we say there's benefit to whole food feeding, there's also risks to raw feeding. The answer has to be somewhere in like, how can we make whole feeding safe as possible to overcome those nutritional deficiencies, risks of infection, and risk to human public health? So what other, they're the main concerns. Can anyone else think of any other concerns with raw feeding or whole feed or unconventional diets, I should say?
I think the probably only one that I've experienced in my family as well is the vegan diets that get quite.
Good point, because I'm talking a lot about unconventional diets but general diets, but people's own dietary preferences are often spilled over into their pets, aren't they? What risks are there to feeding a cat to vegan diet?
Taurine deficiency.
Yeah.
Is there also thiaminases in certain fish as well? Something like that I seem to remember. I've never encountered it, but no, that's a risk as well. That's a bit scary.
Fish-only diets in cats used to result in thiamine deficiency. Yeah.
Is that only if it's raw? Like, do the thiaminases get destroyed if they cook them?
That's such a good question.
I think it's cooked is the problem, I think.
Cooked is the problem? Because I think you're right, because it's raw egg that deactivates thiaminase. Or it breaks down thiamine.
Oh, wow.
And fish. And I knew one of them was raw, but it's definitely not cooked egg. So it must be raw egg and raw or cooked fish. But I don't know, because most of the enzymes are heat sensitive. So if it's a few days,
you would have thought it would get destroyed.
Yeah.
Unless it's already destroyed the thiamine in the food, and that's why it doesn't have any thiamine.
Maybe that's it.
Yeah.
We'll
look into.
Yeah. It's interesting because that used to be such a common problem before before we started regulating, okay, thiamine has to be present in commercial foods and everyone needs to be commercial feeding. But now we are going to see a trend back towards those diseases and nutritional deficiencies where people haven't done their research or have gotten inaccurate information from somewhere.
Mm.
So it would be good to know that actually. I'm gonna look that up. Lemonades. Good. Okay. So certainly vegan diets have come with a lot of nutritional deficiencies, but mostly just because they're not balanced. And a lot of people are buying commercial vegan diets that haven't been properly tested or regulated. And then those people that would prefer to cook for their dog a vegan diet or cat, it's very hard to achieve a balance because there's a lack of supplements that are vegan. So a lot of them contain animal products. And a lot of people have this theory, well, I can eat vegan, I'm healthy, that my dog will be healthy, but over time that will cause problems. Have your family experienced any health problems associated with vegan diet?
And I'm vegan and I'm pretty healthy.
You eat vegan, did you say?
Yes.
Yeah. Well, and what do you feed your pets?
So currently I don't have pets. So that question is right now not relevant. But I'm not going to say anything. I'm looking quiet. To my clients, I don't promote vegan diet. I just tell them to feed commercial diet. But I do want to, there's this guy in the UK, he's a vet, he's doing a big thing because the reality is so far I've not had the time to delve into it. He is, I think his name is Andrew. He has done a lot of research and there's a lot of published things according to him, but I've never really personally looked into it yet. At some point, it's in my to-do list. Sometime in life, I'll get there.
It would be nice to be able to answer those questions from clients because at the moment, I feel a little bit the vet who's saying you can't feed raw food and shutting the conversation down because I can't see a way to do that without supplement.
The way I talk about raw diets, at least in consults, is I'll tell people that, look, I can eat street food and I'm fine. But if you eat street food, then you may get sick. So it's not that the street food is bad or the raw food is bad, but it has the highest potential for contamination. So just like sort of microwaving or steaming takes that potential away, is how I tell people. And most people then buy that because that is the reality. Like I can eat street food and I'm fine.
Yeah. And that's a really good point, actually, particularly with raw food, because I told people to cook it, just fry it up for a long time. And then I realized that a lot of it has bone in it. But those bone shards might cause problems if we cook them. So I just advise people to get the ones that don't have bone fragments in them before cooking them.
And another thing, sorry. I know you did a talk with the Vets for Climate Action the other night. And if your clients are cooking at home, they can buy meat that's much more sustainable and free-range chicken. And, you know, I hate to think of how the cattle and the chickens are kept in commercial food. So I think that's another reason that I'm kind of keen on people making their own food. I can't, I want to do it, but I don't. I feed food out of a packet. But I know, you know, that's where my values are, is to buy free-range chicken and, you know.
Do you think that pet food is sometimes using some of the stuff that's not fit for human consumption though, and that's maybe a good thing?
Definitely using the whole product.
Has anyone tried insect protein food yet?
Not only for myself, not for my pets. But my concern is
there's an Australian soldier fly larvae based food now.
Yeah, but
I haven't tried it.
It's really interesting. I'm just wondering about the digestibility. Yeah, like, do we know that for insect protein? Because we know there's protein, but we don't know. I don't know the digestibility.
I think they claim it's pretty high. I haven't
that's good.
Too much into it. Yeah. But I was thinking for some of our patients where we've exhausted all the other novel proteins, maybe we should be trying.
That's actually where I'm really interested in that novel protein diet. So many bloody dogs of these COVID dogs or IBD dogs that need novel protein diets.
And they've already tried some crock, but in amongst everything else.
Exactly, because people are just going out and trying their own stuff, aren't they? So I'm really excited about soldier fly food for that reason. And what I love about it is I'm always get the words wrong, but the soldier flies eat the waste products from beer brewing. So it's actually it's a closed like loop for like waste. So there's this, it's a very, I don't know, I'm going to use the word carbon neutral, but I'm not actually sure if that's the right word. But yeah, it's very economical and waste free. Yeah. So very interested in that, but I haven't actually got any bioavailability information about it. Whilst we're on the subject of, I guess, risk of home cooking, I think it's important to like make a note of the way that we eat. We don't eat the same thing every meal. We don't eat the same balanced meal every meal. And then one of the reasons why we've evolved to not do that is because when you eat certain things at the same time, your gut will selectively absorb one of them over the other one. So whilst the food might be balanced before you eat it, the actual bioavailability, if you eat it all together, may not be balanced. So what you're actually absorbing may not be balanced. And I think that's just an important observation because a lot of the time we're moving to a home cooked diet or an unconventional diet because of a gut problem or something like that. And you end up finding something that agrees with them and you go, oh, don't feed anything else, just stick with that. And there are situations where a nutritional deficiency could develop potentially with, or a relative nutritional deficiency with that single diet just because of that factor. So if we know that varying animals' diets make them less likely to have gastrointestinal signs, and particularly early in life, so exposing them to a lot of different antigens early in life makes them more tolerant later in life and less likely to develop IBS and IBD signs.
That makes so much sense.
Doesn't it?
Same as in humans, I never thought of that.
Yeah, and interestingly, dogs in that weaning process, like before 8 weeks, if their dam or them are exposed to raw food, much more gastrointestinal tolerance later in life. So
do you think a reason that we're seeing so many of these gastrointestinal intolerances is because puppies are just fed one food, you know, from 6 weeks old and that's it?
Absolutely. Yeah. I actually controversially think the breeders are onto something when they say feed them Weet-Bix and raw meat.
Interesting.
Yeah. So yeah, in like it's different culturally around the world, but in Australia, my experience of breeders is that they very rarely recommend a commercial dog food. Like it's most often some home cooked or home prepared and completely unbalanced, and you're like, what? Why are you feeding the puppy this?
I think things have changed even since I graduated 15 years ago. I reckon some breeders are weaning onto commercial food now.
Yeah, I think there's a little bit more regulation around breeding and people are starting to be a bit more, see the business case in being more responsible in the eyes of the veterinary community, maybe. Because we are putting pressure on them to be responsible because otherwise we'll ban the breeds. There's precedent overseas for that. But I would now, and like having just had a puppy for the first time in 15 years, she got every scrap we could give her, basically. And I was like, raw chicken, here you go. Because the risk is actually relatively low. And like she's never really had a gastrointestinal upset. She's 2 now. And who knows what will evolve over time, but there's enough evidence now and enough common sense that you sort of think if you can build up their immunotolerance at a young age, like we know that having worms at a young age is going to be protective against Crohn's development later. So we know that immunotolerance by infection early in life is protective later in life. And whilst the actual infection or the actual exposure can be a little bit unpleasant, sometimes it's actually protective later. And we're never going to have a study big enough, long enough, strong enough to document that in dogs, I don't think. But there's enough evidence we can extrapolate from humans to say, okay, well, this is probably right. So yeah, I find it hard to recommend because you are balancing risk with benefit much later on. But that was the approach I took. So what else? Oh, an interesting stat I read in my research for this was that if you in an international survey on client attitudes towards commercial dog foods, 84% of owners stated that they were concerned about what ingredients were going into their dog's food. So I think with these high ultra processed foods, when it's not a recognizable food, they're assuming that they're all the scraps and they're not human grade, and they're starting to think, oh, I really want my dog to be eating better than this. So it's like that 84% is a huge number. And I'm sure they only like surveyed like people who visited the vet twice a year or something like that to get that bias outcome. But it is an interesting stat. Has anybody ever read about the biochemical changes associated with the switch from ultra-processed foods to raw feeding? I haven't seen any studies on cooked whole food feeding, which I'm more interested in, but raw feeding. So if you document dogs' bloods before, bloods after, afterwards, you'll see a reduction in triglyceride levels, reduction in ALP, reduction in cholesterol and glucose, and an increase in red blood cells, total protein, creatinine, potassium, and sodium. So it's quite a big metabolic shift. And as someone that is constantly ultrasounding and making recommendations for dogs with unknown ALP elevations of unknown causes, I'm not going to recommend raw food, but I do think it's important to acknowledge that, particularly with the triglyceride, cholesterol, and ALP combination, that perhaps the way that fat is being metabolized and processed in these dogs' bodies may be benefited by a switch to a whole food diet.
So is that from kibble to raw or kibble to whole food, did you say?
That's kibble to raw. That's those studies. So there's a couple of studies that have documented very similar findings. So some of them weren't big enough to have all of those changes documented, but the biggest one documented all of those changes. And ALP, the drop in ALP was documented in all of the studies. So that was the most consistent one, and actually the one I'm most interested in. Something that clinically we deal with all the time. So who's heard, and Bron mentioned earlier, who's heard of a reactive hepatopathy?
Me.
Yeah. What is it?
Yes.
The liver reacts to local inflammation, like the GIT inflammation, is that right?
Yeah, exactly right. Yeah. So it's not, I shouldn't say exactly right. It's not necessarily inflammation. So in humans, they've got these two syndromes. We've got IBS, irritable bowel syndrome, and we've got inflammatory bowel syndrome. So the difference between them is not the symptoms or severity of signs, but it's the presence of a histological presence of inflammation. So inflammation will result in like a reactive hepatopathy, but sometimes just a dysbiosis, which isn't actually causing local inflammation in the gut, but we're getting some toxic metabolites produced by some less favorable bacteria that are living in the gut that are then entering the portal circulation that the liver then has to process out. You might get a liver inflammation without a gut inflammation. There's particular breeds, I think, that are genetically predisposed to probably dysbiosis, but I don't think we've got enough data to say that, but certainly reactive hepatopathies. So greyhounds are one breed that I think we see low-grade ALT elevation and mild gastrointestinal signs, often in the absence of gastrointestinal inflammation. And cavoodles, so many cavoodles, but they've often got gastrointestinal inflammation as well. But those dogs with those intermittent gastrointestinal signs and an ALT, usually does anyone have a feel for what level of ALT elevation?
Should be
Like I feel like it gets up to a couple of hundred, maybe 300-400, and that's as high as it seems to go. Just
yeah. So the Washerbow Day gastroenterology textbook. Does anyone have that one? Has anyone learned it off by heart like me? No? So that says reactive hepatopathy is usually under 800. But it's interesting, actually, because we do a lot of ultrasound and true cuts. We've documented histologically reactive hepatopathies at like 1,500, ALTs of well over 1,000. So it's nice to be able to say histologically that's what's going on. But if you've got waxing and waning gastrointestinal signs and an ALT under 800, I would usually consider the risk of a true cut higher than the risk of going down a treatment trial for dysbiosis, and try and manage microbiome and see if we can get the ALT down that way.
Were you saying the non-inflammatory waxing and waning GI signs is kind of equivalent to human IBS? Or
yeah,
okay.
Yeah, if there's no histological evidence of inflammation. So we used to do biopsies and call that SIBO because we have no way of documenting it. So we'd say, got like quite severe gastrointestinal signs and there's no inflammation here. We're going to call it small intestinal bacterial overgrowth. Now we know that overgrowth, like we might have overgrowth of one species, but undergrowth of another species is actually the balance rather than a single bacteria that's responsible for that. So yeah, we're kind of changing our terminology to being dysbiosis rather than overgrowth, which is kind of misleading because you want to treat overgrowth with antibiotics, right? Yeah. So let's talk about dysbiosis then. That's a nice segue. So one of the impacts of these ultra-processed foods in humans is dysbiosis. So we change in high starch food, we'll select for certain bacteria to like have it's a favorable environment for them. Food that doesn't have its own bacterial pathogenic, no, I shouldn't say pathogenic, but its own antigenic load with like bacteria and like, we eat yogurt and things with bacteria in it all the time. Things that doesn't have its own load means that it doesn't compete for binding sites or nutrients in the bowel. So those bacteria that are living in that proximal area of the bowel have got no competition. They're just doing whatever they want. So there's a few different impacts of how diet can impact like the microbiome. But that's also true with whole food feeding. If you're feeding a really consistent diet and there's no variation, then those bacteria can get quite comfortable and quite stable. Whereas if you're eating a very varied diet, your microbiome is going to vary a lot as well, which can be a good or bad thing. Develops tolerance. It promotes immunotolerance. But also, if you've got a sensitive stomach, that's going to upset things. You're going to be more likely to have gastrointestinal signs. So pros and cons. Healthy dogs, I'd promote a varied diet. Dogs with gastrointestinal signs, I'd say let's be really consistent. So what happens when we get, I'm going to go backwards. So diet is a big predictor of dysbiosis. What other factors might contribute to the development of dysbiosis?
Antimicrobials.
Great. Big one. Yeah.
Big one.
Mm-hmm.
Indiscriminate use.
Yeah. And quite discriminate. Like sometimes we have to use them, right? Like, but we need to be aware of the impacts we're going to have and the vulnerability of the gut in that period after antimicrobial usage. The gut's pretty good at getting back to its baseline if we support it. It's just that period where it's vulnerable afterwards. If they get like gastrointestinal signs and antigen exposure and mount an immune reaction and inflammation, much harder to undo in that period. And we know that animals that aren't exposed to or are exposed to high levels of antibiotics and not exposed to environmental, like if it's a cesarean birth as opposed to a natural birth, they've got much less stable microbiomes than animals that either had a natural birth and exposure to all those bacteria and organisms, or animals that didn't get exposed to antibiotics. So all of those are sort of predictors of gut health later on in life. What else impacts dysbiosis?
Any drugs affecting digestion, like proton pumps inhibitors?
Excellent. Yeah. And I'll throw in there pancreatic dysfunction as well. So anything that will alter the pH in the proximal bowel will alter absorption of nutrients, will alter bacterial populations, because certain bacteria like acidic environments, certain like basic. So if you've got a fluctuation in that pH, you're going to get a bit of population control. Whereas if like the pancreas or biliary system is dysfunctional and we're not getting that alkaline tide, they call it. So the stomach pumps acid into the duodenum, and then the biliary system and pancreas pump bicarb into the duodenum, and you get this like fluctuation. So if either of those, any of those are dysfunctional, so proton pump inhibitor, decreasing gastric acidity, or pancreatic or biliary dysfunction, will all contribute to changes in microbiome full stop.
What about stress? Like, will
I
stress?
don't laugh that you said that. Yeah, I thought no one was going to say that. But yes, so psychological stress, physical stress has dramatic impacts on the microbiome. Hi. That's such a sweetie. Now I want to show you my dog.
Yes,
Sorry,
please.
it's distracting.
Yeah, it's fine. Mine looks similar. Pointy black dog. Yeah, so psychological stress has a huge impact on microbiome and vice versa. Like they feed off each other. So there's so much more data coming out about that in dogs, actually, because anxiety is such a cause of suffering in dogs and death, because euthanasia is the result of it often. And anxiety is a crisis because of the way that we're living with our dogs now, not really suiting them, being so attached and then leaving them all on now. So what does dysbiosis trigger in the gut to make gastrointestinal signs? How does that impact gut health?
Like you'll have overgrowth of one kind of bacteria, whether it's harmful or whether there's reduction in beneficial bacteria.
And
That's
how does that then impact gut function?
because I think every sort of microorganism has its role. So if you have proliferation of one or decrease of the beneficial one, then it is going to affect.
Yeah. And
Is it about their kind of metabolites and that influences like their signals for the cells?
Yeah.
What's absorbed, what's not absorbed?
Yeah.
What's secreted, probably.
Yeah. It's all of those things. And like interestingly, like I want to kind of go onto more like what diseases can we like potentially use the microbiome as a therapeutic target to manipulate the disease down the track. But it's interesting what bacteria, hi dogs, what bacteria produces that will, like, you sort of think like, how can that, you ate a starchy food, how can that possibly impact seizure frequency? But it does. And we know that now, like we've got enough evidence to say that there's a very strong evidence for dietary manipulation decreasing severity of seizure activity.
In dogs, do we have that evidence, or just in people?
We definitely do. In the consensus statement for management of idiopathic epilepsy, dietary modification is one of the strategies.
Are people using a particular commercial diet, or do we have to go for something else? I noticed Vet Nutrition Group, actually, they have one on their website for cancer and epilepsy, so that maybe is low in carbs. They should have one.
So it's almost like Atkinsy, the diet, with a high medium chain fatty acid. Brain diet, the BD, which is designed for cognitive dysfunction, is suitable. But there's a really good paper that looks at the exact composition that works really well, which I will try to find. Yeah.
I'll have a look. Yep.
Okay, yeah, it should, I'm sure it's JVIM. I can see it. Either that or the veterinary journal, one of the two. Black and white. That doesn't help. Yes, so really interesting. Like I want to definitely talk about that. But I want to talk more about how dysbiosis will impact the actual gut itself. Because there's a lot of terminology that's like being thrown around a lot in the human world, which we know happens in dogs as well. Cats we don't have as much data on. And this is the kind of stuff that your clients are going to come in asking you about. So has anyone heard of a leaky gut? Yeah. So as Bron mentioned, that breakdown of that mucus layer means that there's less of a barrier between all of those antigens moving through and the gut itself. But we also see a decrease in efficacy of the tight junctions between the cells. We see disordered absorption of nutrients and the other byproducts of bacterial metabolism, microorganism metabolism, because there's fungal organisms, there's viral organisms, there's bacteriophages, there's so many things at play in here. All of that will increase the permeability of the gut, and that will cause this leaky gut syndrome. And we do have evidence of breakdown of those tight junctions and things in patients that have dysbiosis. So whilst there might not be inflammation locally, there's definitely dysfunction of that gastrointestinal epithelium. Epithelium? Yeah, it is epithelium. Sorry. So we get, when you've got leaky gut, you get absorption of all of these byproducts and things, disordered absorption, and you get systemic inflammation. So that's where the link is between diabetes, cancer, autoimmune diseases, and neurodegenerative and cardiovascular diseases. Is systemic inflammation causes all of these things, and there's different balances that will contribute to one over the other, and different genetic predispositions that will make people and dogs more prone to one or the other, but we will exacerbate and advance all of these diseases if we're not managing gut health with them. And gut health is therefore a therapeutic target in all of these diseases to modulate progression, potentially. A knock-on effect of messing with the microbiome is, like, we sort of talk about the impact on absorption and systemic health, but what about more distal bowel health and therefore gastrointestinal signs that we actually see manifesting? If you've got a malabsorptive disorder or an alteration in particularly fatty acid digestion absorption, what feeds the colonocytes?
Bacterial products.
Yeah. So essentially,
Also colitis. Okay.
Yes, yeah, exactly. Yeah, so that's when we're actually seeing these gastrointestinal effects, it's most commonly large bowel, isn't it?
Yeah.
Yeah. So it's not telling us problems in the large bowel, it's telling us the large bowel is not getting enough nutrients because the small bowel's not working.
Oh my gosh. So I'm giving psyllium and I'm just like doing a band-aid.
Well, no, because you're improving the dog's quality of life, and that psyllium is actually altering the microbiome further up as well. So, you're padding out the feces, but we know that increasing fiber also changes the microbiome further up. So it's definitely, honestly, microbiome manipulation is like, let's just try a little bit of this and a little bit of this and a little, see what happens, because the imbalance is different for every dog.
Right.
So go for the psyllium. Go for the probiotics.
But I never thought of that. The problem wasn't originating in the colon.
Yes. Yeah.
That's interesting.
Yeah, because butyrate is the primary nutrient, short-chain fatty acid in the colon. Colonocytes don't get any nutrition from our blood supply. They get it all from the lumen. So if you don't have good quality nutrition from that bacterial byproducts produced further up, then the colon will be unhealthy. It's all linked.
Amazing.
Okay, tell me, how would you diagnose dysbiosis?
I think it's just symptoms, isn't it? Like, and history, you put them together. I don't think there's like a particular test per se.
I don't think that we can't do a dysbiosis index in Australia, can we? I haven't seen anything.
Do you know what? Somebody sent me an email the other day saying that the Fecal Microbiome Lab, Texas, I think, will send you a tube to put the poo in, and you just send it back to them, and they've done all the paperwork for Homeland Security and stuff like that, and they will do a dysbiosis index. So I know
What, even if it takes like 3 weeks to get there?
Yeah, because it's genetic, right? It doesn't have to be fresh. It's not like we're relying on the organisms being stable.
Alive.
The genetic
Yeah,
is real stable. So that all the organisms can die, but the genes will still be there and we can detect them.
But do we know that that's actually relevant results? Like, what we do think the microbiome index is useful?
Yes. Yeah.
Okay, because it's not growth, it's DNA.
Exactly. Yeah, exactly right. So that gives us an idea of what the dog's excreting. The trouble there, so what other limitations are there? So number one is it's giving us what the dog's excreting. It's not giving us an idea of what's happening in the proximal duodenum. So what's going on in the colon might not necessarily reflect what's going on up here. What other limitations can you think of?
I mean, it's just one moment in time as well, I
Yes,
suppose. So,
good.
like,
So
I think the most information would be repeating it after treatment trials or
absolutely. Yeah, completely agree. And particularly if you've got owners that are fluctuating food or varying food, you're going to get fluctuation. There's variability in what organisms are going to be in there after a starchy meal versus after an all meat meal. If they've just had an episode of gastroenteritis, for example, or like recovering from that, the bacterial population is going to be very different than it will be in like on balance. So I think serial assessments, as you said, are really important to get a feel for what's going on there, or assessing patients when they are quite stable, like maybe not well, but stable. Where I think it's interesting is these dogs that don't necessarily have gastrointestinal signs, but maybe have epilepsy or diabetes or some other chronic illness, which might lend itself to microbiome manipulation.
Isn't there a study which is showing that like even short course, so this is not just this thing, but like even short courses of metronidazole will change the microflora in the body and or gut, and so they've in that paper I think they've mentioned the dysbiosis index, but I wasn't sure whether it's something that's commercially available or whether it's just like research institute sort of a.
So the trouble with any test that people start to use is that other laboratories will make their own version of it, which isn't as nice
Validated.
Yeah. So I'm pretty sure it's Texas.
Texas probably, because Texas is the big
yeah, Texas is the GI lab.
GI lab. Yeah, it's a big GI lab.
So that's where I would send it there, because that's the one that's got the most evidence for it. The profile that they're using is like very evidence-based and consistent. And they send the tube out. So good incentive to do that. But they've put, so the author of all of the chronic enteropathy papers when I was studying fellowships is the person running this lab now. So for somebody who's, like you sort of think, oh, like microbiome, it's a little bit hippy dippy, but this is like a deeply scientific person, like the world leading expert on chronic enteropathy and chronic gastrointestinal signs, is now completely immersed in study of dysbiosis and the impact on more overall health. So that like there's so much science now here and very well run studies coming out. And if we don't run those studies, we're never going to generate the data. Or if we don't run the samples, we're never going to generate the data. So whilst there's not necessarily clinical decisions that I'd make based on that microbiome, the dysbiosis index, I do think it's informative. And for example, if you've got a plethora of bacterial overgrowth, let's use the word overgrowth, and like low yeast, then I'm going to go a yeast-based probiotic rather than a bacterial-based probiotic. The prebiotics that I want to incorporate into my food are going to be different from if I had a yeast overgrowth. So there is definitely like little manipulations we can make with diet that, and honestly, if you look at like probiotics, beg your pardon, there's one specific formulation combination of bacterial probiotics which have the same results as prednisolone and metronidazole in chronic enteropathy. But to be able to give a probiotic instead of an antibiotic or prednisolone, which just comes with so many systemic effects, and have know from evidence-based that it's just as effective. It's a very powerful treatment tool. And
is that a multi-strain product?
Yeah, I think it's got 3 different strains in it. It's called VSL number 3. But
I was looking that up the other day.
Were you? That's the one.
Yeah.
That one.
Yeah, right. That's the one. Okay.
Did you find
Yes, you can. Yep. A client got it from the pharmacy. Yep.
Oh, I love it.
Yep.
Amazing. Okay, I'm gonna definitely be recommending that.
Was that paper in dogs or humans, Anna, about the equal? Okay, cool.
Yeah.
But it's a human probiotic.
It's a human probiotic. Yep.
Yeah.
Yep.
Okay.
It's in like little sachets. It's pretty exy, but
yeah.
Okay, so let's talk about a couple of different diseases which are specifically impacted by microbiome. Seizures in particular, having that diet that we talked about, the key in there is the neuroactive compounds that are produced by bacteria in the gut. So we know that like bacteria produce a whole heap of chemicals. Those chemicals can impact seizure threshold by either potentiating GABA, so making them more like lower resting potential, less likely to trigger an action potential, or they can increase their resting potential, so make them more likely to have an action potential. So they can directly impact efficacy of our neuroreceptors, but also our medications, which are acting on those same receptors. Interesting one, which I hadn't really kind of clinically made the association with, but the gut bacteria actually produce some of the uremic toxins. And those uremic toxins are systemically absorbed and they're supposed to be excreted renally. And when you've got reduced renal function, that they then stay in the system. And some of them in particular actually directly cause renal inflammation and fibrosis. So they exacerbate progression of chronic renal disease. So if we can like selectively target the bacteria that are producing those compounds and compete with them or decrease the number of them by changing the balance somehow, that's a potential very low morbidity therapeutic target for decreasing progression of renal disease. And this is something where the microbiome analysis can tell us that. If we know, okay, well, it's this compound that we're trying to avoid, we know this bacteria does this patient has this many of that bacteria, it's therefore a therapeutic target for this patient, not for this patient. And then mitral valve disease, actually, E. coli numbers contribute to progression of mitral valve disease because of a specific product that they produce, which I can't pronounce. Trimethylamine N oxide, apparently, which actually increases cholesterol and systemic inflammation and contributes to progression of mitral valve disease. So interesting.
Amazing.
Isn't it? And then we know about this gut-brain axis, right? We know when we feed our children red cordial, their behavior is not optimal. That same goes for dogs. So particularly with anxiety and things, feeding diets that decrease those the upregulation neurotransmitter chemicals can make a huge difference to the dog's well-being and therefore the owner's well-being as well. So there's a lot of exciting stuff coming through, I think, in this field. Does anybody have any? Oh, do you want to talk about fecal transplants quickly? Everyone's like, no.
Are you doing them, Anna?
Well, I don't because I'm not in a clinical situation, but if I was in a clinical situation, I absolutely would be. I recommend them often. So there's
We need to get a more efficient way of doing it that's not a blender and
I know, but you know, there's no reason why a vet needs to be doing this. Like, this could definitely be a tech that gets trained up as a specialty. Julian's like watching me just going. But there's huge benefits in some patients. So like I think it's 50% of patients will have improved feces after a fecal transplant. And sometimes that effect wears off and they'll need another 6 to 8 weeks later. But if we can decrease the cost of that to the client, then the impact on the dog is so minimal. If they can just come in and have someone just sort them out, like have fecal transplant day and you just get 2 poos, make a pooled sample. There's actually a really good paper that Matt sent out that's got a link to the protocol which works, and a review of the evidence. So I think that's definitely a way of rapidly manipulating the microbiome. And it does, the microbiome, if you do a dysbiosis index, it goes back to its baseline quite quickly, but the benefits are longer than the microbiome index as the dysbiosis is. So the dysbiosis index goes back to where it was, but actually the poos are still better and the client still feels like they're better. And some dogs are non-responders, and some dogs' poo doesn't suit that dog's microbiome, and getting the balance right is a little bit trial and error. But in humans, there's a man with a golden stool who's like cured people of ulcerative colitis. Like he's got the poo that does that.
This is something, because it is adds another level of, you know, hustle to care. Like, is this after you've tried diet and you've tried probiotics and
you've done your endoscopy? Like at which point, because we do it as like an absolute last resort, like that's we're reaching for it, like after everything else.
Traditionally, I've done it as a last resort, but actually in terms of invasiveness and risk balance, when I look at it, kind of take a step back and look at it holistically, if the patient is generally well, doesn't have protein loss, and just has these intermittent gastrointestinal signs, then I would probably do it before I did the endoscopy and biopsy, because the endoscopy and biopsy is going to prompt pred. Like, that's why you're doing that, right? Like, you're doing it for evidence of like evidence to justify something that comes with morbidity. So yeah, I would do it before.
I think they're looking at doing this even at least in the States. I was listening to some webinar and it was they like this. I can't remember the exact details, but they were looking at it and doing even in just not chronic enteropathy, but also acute settings like your acute AHDS cases. And in the US, there is one particular place where they're actually making these caps, like they're making poo capsules. Which is so,
I think
that takes
I listened to that too, Pooja. It would be so much easier. It'd be so much
easier.
But it's not that hard. I've seen it once, and it's not that actually. Like, I think I would like to do it because it's
making poo capsules not that hard, or poo transplant.
Well, there's a little machine that does it for you somehow.
No, I meant like the fecal transplant itself.
Yeah, it's not hard. It's not hard at all. It's annoying.
It's messy.
Yeah.
Convincing the nurses that it's something they really want to do.
I think it's more in our heads. Like, it's just because it's poo like that, but it's actually not even messy. Honestly, like compared to some of the things we do, I think it's not that messy.
It's actually probably cleaner than a colonoscopy prep.
Yeah.
So that's a good incentive for your nurses. If this works, you don't have to do a colonoscopy prep. I think it's a really interesting field. It's there's lots coming out here.
We do a lot of poo shakes in koalas all the time. It's like
poo shakes.
Yeah, and sometimes they actually
orally or fecal or rectally. Oh, really? Interesting.
They actually like sometimes having it. Like, you'll offer them this poo shake that we make, and then sometimes they'll actually eat it.
Also, you don't need to like tube it in. They'll actually just like take it orally.
So like usually we'll give it by syringe and have to force feed it, but sometimes if they're really sick, like in the acute setting, or like severe dysbiosis, they'll actually just lap it up.
Yeah.
Do they normally eat cecotrophs?
No, they don't.
Interesting. That was my
But
question.
koala poo is surely less offensive than dog poo.
100%.
Yes, that's true. That's so true.
So cool.
What was I going to say? Oh, acute setting. Parvo dogs much more likely to be discharged from hospital sooner if they get a fecal transplant. And AHDS, like you said. Yeah, really interesting. All right, we better go.
And I'm so interested in this area. Could you send us through those papers from Matt and let me know where else I can find up-to-date stuff, because I don't think textbooks are probably going to cut it.
No, textbooks are out. Podcasts are the best thing for sure. If I find any, I'll flick them to you.
Yeah, awesome. Thank you so much.
All right, cheers, guys.
Have a good day,
See ya.
Have a good day.
Bye.
Bye. Thank you.